Hello, this is the 2-minute warning. Please press 1 to ask a question.
Good afternoon, everyone, and thank you for joining today's update on COVID-19 in North Carolina. As of today, we have 48,188 lab-confirmed cases, 1,333 new cases reported today, 857 people in the hospital, and 1,175 people who have died. These numbers continue to concern us, and our prayers are with everyone fighting this virus and those who are grieving a loved one. In the past week, we've averaged about 16,800 tests a day, and that's good. This is a significant increase from where we were even a month ago when we averaged around 7,500 tests per day. And there are now more than 500 testing locations across our state that you can find on the state's interactive website. Over the weekend, I personally asked Vice President Pence for federal assistance in setting up even more of these testing locations in our state. That's going to be especially important as health directors identify hot spots for virus spread, which we have across our state. Now, more testing can help us slow the spread of COVID-19, and we'll push for testing sites and supplies that North Carolina needs. And today, prison officials are announcing their plan to test every inmate and staff member at state prisons. And our Commissioner of Prisons, Todd Ishii, will share those details in just a minute. Finally, I want to talk again about the strong, proven methods to slow the spread of this virus: face coverings and social distancing. Guidance from the CDC and many health experts all over is clear. These work. We're looking at ways to significantly increase the use of face coverings, and I applaud the stores and businesses that already require them. We're examining carefully the issues surrounding a statewide requirement of face masks, and some of our local governments have put these requirements into effect already. Regardless of whether it's a law or a store requirement, wearing a face covering when you're around other people slows the spread of the virus. This is a low-cost, low-tech way to protect ourselves and our communities. It's an important way to slow the spread of the virus without hurting the economy. We wear them here at the Emergency Operations Center. No, it's not the most comfortable thing that you wear, but you get used to it. It's a piece of protection, like gloves in freezing weather or a sun hat in warm weather. An extra thing that you put on that keeps you healthy. And this piece of protection may even save your life or the lives of your loved ones. The evidence continues to mount up that this is the thing that we should do to slow the spread and get our economy going. As we continue our activation here at the Emergency Operations Center, I want to thank Dr. Mandy Cohen and Director Mike Sprayberry and their teams for their tireless work fighting this pandemic. You've both led by example since day one, and our state is fortunate to have you. And with me today is Dr. Cohen, along with our Commissioner of Prisons, Todd Ishii, and our Director of Emergency Management, Mike Sprayberry, and also our Secretary of Public Safety, Eric Hooks, is here. And I want to say a particular note, our thoughts are with the people in eastern North Carolina right now who are having flooding. And Director Sprayberry will talk a little bit more about that in a minute. Our sign language interpreters are Karen Magoon and Brian Tipton. And behind the scenes, Jackie and Jasmine Mativier are our Spanish language interpreters. I'll first recognize Dr. Cohen.
Well, thank you, Governor. As the Governor just reported, today's numbers show yet another high day with more than 1,300 new cases. And while we've also seen testing increase to over 21,000 tests done yesterday, we know the increases we're seeing are not solely due to testing alone. Our percent positive test remains elevated at 9%, and our statewide hospitalizations inched up to a new high at 857 people hospitalized. Until we have a vaccine for COVID-19, we know we're going to have to learn to live with this virus. And we need to rely on the tools we have right now to slow the spread of the virus, and it starts with the 3 W's: wear, wait, and watch. Just like the Governor just mentioned about the importance of face coverings, I want to do a quick demonstration. First, the face covering needs to go over both your nose and your mouth. And make sure that when you are taking on and off your face covering, you want to do that by the ear coverings here and not touch the front. And when you take it off, washing your hands right away. New research shows that this is an incredibly effective tool. Recent U.S. and international studies are showing us that face coverings used by the public all the time, not just when symptoms first appear, could significantly reduce the rate of COVID-19 spread. One study found that face coverings reduced the number of infections by over 78,000 in Italy and by over 66,000 in New York City between April and May. Other research estimates that the daily growth rate of COVID-19 cases in Germany fell by around 40% due to wearing a mask. Face coverings that cover your nose and your mouth help because if you have COVID-19, you may not know it yet. You can give it to some other people before you have any symptoms. We all need to take precautions. As we dig into our data, we're seeing that recent increases in our cases are really being driven largely by younger folks, people ages 25 to 49. And while younger people are at lower risk for severe COVID-19 disease, they still can spread it to others who are at higher risk. Remember, more than half of our fellow North Carolinians are at higher risk for severe complications from COVID-19. And as we move around more, we're going to come in contact with people every day who could become seriously ill with COVID-19. By wearing a face covering, we can protect all those around us from the virus, our loved ones, our neighbors, employees at our local businesses, and our frontline workers. That person could be someone's grandfather who's waiting in line in front of you in the hardware store, or maybe someone's diabetic sister who works at the local grocery store. Let's help protect them by wearing a face covering that covers your nose and your mouth when you're out at any time. Now, at the state level, we're going to continue to ramp up our testing and tracing across the state. Our efforts continue to be focused on her historically marginalized populations and communities with high levels of viral spread. This week, we distributed more than 10,000 testing supplies and 37,000 PPE items to those priority counties we're working closely with in our first round of partnerships. If we all do our part, we'll slow the spread of this virus so we can continue to ease restrictions and return to the things that and the places that we love. We can protect our families and neighbors and slow the spread of the virus starting with those 3 W's: wearing a face covering, waiting 6 feet apart, and washing your hands frequently. And it's the combination of those actions that protects everyone together. Please continue to take care of yourself and those around you. Thank you.
Thank you, Dr. Cohen. We'll now hear from Emergency Management Director Mike Sprayberry. Mike.
Thank you, Governor, and thank you for your leadership. Good afternoon. I want to start off today with the current flooding report from this week's severe weather and rain. River and stream levels are falling today across the Tar River Basin, where significant flooding continues, particularly in and around Rocky Mount and Nashville. Conditions are still dangerous there this afternoon. Many roads remain flooded and closed, and first responders are still rescuing people from flooded vehicles and homes. If you encounter a flooded road, turn around and find another route. Turn around, don't drown, don't risk your life or risk losing your vehicle. Nash County reports 42 residences that were evacuated yesterday afternoon and evening as waters rose. Downstream in Edgecombe County, the Tar River at Tarboro is expected to crest Saturday morning. At the current forecasted peak, the area of Princeville behind the levee should not be impacted, but we are monitoring very closely. At peak yesterday, there were just over 12,000 power outages. Damage assessments in the impacted communities are ongoing. With only scattered showers and thunderstorms forecast for the next few days across eastern North Carolina, floodwaters should recede and conditions should continue to improve. Today is day 101 of the State Emergency Operations Center's COVID-19 response. We received good news from FEMA this week that the state's request for the Crisis Counseling Immediate Services Program was approved with a $1.5 million grant. We're also moving ahead with an application for the more substantial Regular Services Program for crisis counseling so that we can continue to support North Carolinians in need as a result of this pandemic. DHHS will share information soon on the implementation of crisis counseling to help those struggling with the many effects of COVID-19. I'm happy to announce that through a program called Project America Strong, the federal government is now distributing cloth face coverings to state and local governments and companies in certain infrastructure sectors like food, agriculture, energy, water, wastewater, transportation, communications, and emergency services. Information on these free cloth face coverings and how local governments and critical infrastructure sector companies can request them has been distributed through state and local emergency management channels, and we will continue to push that information out. As Secretary Cohen just explained, wearing a cloth face covering is one of the best things we can do to slow the spread and care for the vulnerable in our communities. We know that food insecurity has doubled in our state since the start of the pandemic. Many people who are already struggling to feed their family before COVID-19 are having an even harder time now. That's why it's so important to support our state's food banks at this time. The North Carolina National Guard continues to help food banks with manpower, logistics, and transportation, but the food banks need your help financially to get the food supplies they need. You can donate to a food bank near you by visiting feedingthecarolinas.org. Again, that's feedingthecarolinas.org. Thank you in advance for your generosity. Lastly, remember to observe the 3 W's. Wear a cloth face covering, wait at least 6 feet apart, and wash your hands often. That's wear, wait, and wash. This is how we slow the spread of the virus by working collectively together. And as always, don't forget to look out for your family, friends, and neighbors, and to call your loved ones daily. I guarantee they'll appreciate it. With kindness and cooperation, we'll all get through this together as one team, one mission, and one family. Thank you, Governor.
Thank you, Mike, and we appreciate those rescue workers out there helping to get people evacuated. We'll now have our Commissioner of Prisons, Todd Ishii.
Thank you, Governor. Good afternoon, everyone. Based on updated guidance from DHHS, we have begun testing of all 31,200 offenders throughout our prison system for COVID-19. We estimate it will take at least 60 days to complete this testing, and it is estimated the process will cost about $3.3 million. The test will be analyzed by LabCorp, with the results transmitted directly into the Division of Prisons Offender Healthcare Records, and results will continue to be posted on our DPS website. Testing is currently underway today at Albemarle Correctional Institution in New London in Stanley County. We are already testing everyone transferred to prison from our county jails. They are being held under medical quarantine until the test results are returned. In addition, we will test the offenders in the limited cases where we need to transfer offenders between facilities, or we will keep them in medical isolation for 14 days in lieu of testing upon arrival at their new facility. The North Carolina Department of Health and Human Services updated COVID-19 testing guidelines last week on June 9th. As of today, we have tested 2,809 offenders housed in our facilities, and this is almost 10% of our entire offender population. The majority of offenders in the state prison system who tested positive for COVID-19 are now presumed to have recovered. Of the 717 individuals who have tested positive so far, 635 have met CDC and North Carolina Department of Health and Human Services criteria to be released from medical isolation. Our top priority is everyone's health and their safety, and I mean everyone. I recognize this has been a very difficult time for our staff and offenders, and I am grateful to our hardworking and dedicated staff for their continued hard work and service to our state. And I also appreciate the patience and assistance from our offenders during this unprecedented time in our history. Thank you.
Thank you, Todd. We'll now open the mic for questions, and if you can identify yourself along with your organization, please. Let's have our first question.
Our first question is from Michael Falero with WFAE.
Yes, hi there, Governor. What would it take in terms of our increasing trends across the board in order to go back to some form of the stay-at-home order?
We watch a combination of indicators to tell us what to do regarding easing or imposing restrictions. Those indicators are the total number of positive tests, the percentage of positive tests, along with our hospitalizations, and along with COVID-like symptoms that people present to the emergency room with, one of our early indicators. We do not want to go backward. What we want people to do is to do more to wear face masks and social distancing, because we can together slow the spread of the virus while at the same time boosting our economy. And that's not to say if our medical facilities, if they were overwhelmed, then we would have to consider such a thing. But we don't want to go backward. And we're going to work as hard as we can to make sure that we're slowing the spread out there. But that's going to take every single North Carolinian. Thanks. Next question.
Our next question is from Ashley Talley with WRAL.
Hi, Governor. Going back to what you first said about considering a statewide requirement for masks, as you probably know, Virginia recently did this and saw their numbers go way down. What are you looking at to make that decision, and what would it hurt to make it?
Well, clearly we want people to wear face masks. We're looking for the most effective ways to do that. There are different requirements that you can make. Lots of, whether you're in a public place, whether you're in a retail store, whether you're in a school, whether you're working on a manufacturing floor, all of those things we have to consider in this process. And we hope to be, when we announce next week about what we're going to do regarding the order that ends June 26, we hope to be announcing a comprehensive plan to slow the spread of the virus in North Carolina. We want this to be second nature to people. When you think about a face covering, it does a couple of things. Number one, it's something everybody can do to pitch in to slow the spread of the virus. And number two, doing it doesn't hurt the economy in any way. So those are two positive things, and the mandatory nature of it is being considered and studied, and we'll let you know something about our comprehensive package next week. Thanks. Next question.
Our next question is from Thomas Wybeck with WITN.
Hi, Governor. Some are saying that, well, it's highly recommended to wear those masks in public, that it's a matter of personal responsibility and it shouldn't be a requirement. With more and more businesses opening up and, of course, the mask mandate taking effect in Raleigh tomorrow, do you think the mask goes beyond personal freedom? Thanks.
I think public health is a priority, and there are laws in place that allow protections for the public health. And here with face masks, this is a proven way that you can protect the people who are around you and who come into contact with you. And we want to encourage that across the state. We don't want to have to impose restrictions unless it's important to further the public health. And we know that the evidence is continuing to pile up how important it is for people to wear these face coverings, because you may not know that you're infected with COVID-19 and you could be spreading it. So we want people to wear these. Next question.
Our next question is from Brian Anderson with the Associated Press.
Hi, Governor. Hi, Dr. Cohen. It's a question for each of you. Brian Anderson with the Associated Press. Thank you for the time and accessibility here. First, for Governor Cooper, I was just hoping you could share a story, maybe it's from a business owner or COVID victim, that has personally shaped your attitude as you evaluate whether to open up more of the economy. But across the state, Hispanics account for about 45% of cases while making up just 10% of the population. What's your advice specifically for undocumented and or uninsured residents who are concerned about going in for a test because they might miss work and can't afford to do that? My question for Dr. Cohen, for the past week, we've been trying to get data from your department breaking down age, race, ethnicity, and gender by county since the pandemic began. If your department has this information, why haven't you released it yet? And if not, how can you reassure the public your department's able to make science-based decisions when you either don't have that data or refusing to publicly disclose it? Thank you.
A sheriff's deputy, school resource officer, Officer Budd in Montgomery County, was a beacon of light in his school. The children loved him. He could tell, he not only provided protection for the students in school, but he was a source of comfort. He could tell when a student was lonely or being bullied, and he would intervene and would help. And he lost his life to COVID-19. We have close to 1,200 North Carolinians who've lost their life to this cruel virus. So when we think about slowing the spread, we have to think about people like Officer Budd. And we have to think about everybody who may be in our state that could potentially spread the virus. So we want all kinds of people to go and to get tested, particularly if they have been in a crowd or particularly if they are in working conditions that might lead to the spread of the virus. We're very concerned about our communities of color, Black North Carolinians, Latinx North Carolinians who have a disproportionate number of people who are positive for this virus. We're concentrating a lot of effort in these underserved communities to get more testing, to get more tracing, to provide protections for workers. So it's important for us, regardless of anybody's status, it's important for us to zero in, test, trace, and slow the spread of this virus. I'll give the mic to Dr. Cohen.
Thanks, Brian, for the question. As you know, our dashboard that we update daily has a lot of detailed information on it, and we're always trying to make improvements to share more and more information as we are able to do that with the public. And so we agree with you that it is very important for us to now make the next step and get more information broken down by county. And so we are working hard to do that, and I hope to have another update to our dashboard very soon, even within the next week, on additional county level data, though right now you can go and there's an interactive map that helps you look at our cases both by county and by zip code, and we hope to layer on additional race and ethnicity data. I think the requirements by the federal government in terms of reporting that information made it much more helpful for us in order to be able to have that information in a systematic way. So stay tuned for additional details from us very soon. Thank you.
Thank you. Next question, please.
Follow-up, Brian Anderson, Associated Press.
Sorry, just for the governor, about the Hispanic population, with them accounting for 45% of cases but making up 10% of the population. I know there's some resistance to getting tested because of the economic factors at play. What would just be your advice to them?
There testing sites where you can go to where it is free. At Walmart, Walgreens, we've got those 500 sites across our state that are on this website, and we encourage people, a lot of these places are open all kinds of hours, when they are off work to go and get tested. It would be one of the best things that you could do for yourself, for your family, for your coworkers. I know it's economically tough for people when they have to isolate for 14 days if they test positive, but the cost would be a lot more than that. We're also pushing meat processing plants and other employers to provide for sick pay in order to encourage people to stay home if they test positive or if they have symptoms of COVID-19. Because we don't want to infect the rest of the population, and the employers shouldn't want that to happen either. A lot of work has been done by the Department of Health and Human Services to try to help this situation, help this population. We still have a lot of work to do. Next question, please.
Our next question is from Katie Peralta with the Charlotte Agenda.
Hi, Governor Cooper. This is Katie Peralta with the Charlotte Agenda. Based on a report this week from Health Affairs, 15 states, as well as Washington, D.C., all mandated mask wearing in public for a time between April and May. And the report said that they averted as many as 230,000 to 450,000 COVID-19 cases. Given this new research and given our current trends and behavior in North Carolina, do you think that we should have had a mask mandate sooner, either on the state level or at the county or city level?
We need more people to wear masks, and we need to figure out the best way to do that. As I said earlier, we are looking at all of the data, particularly the new studies that have just come out. We want to come forward in an effective way. You're going to soon see public service announcements from hockey players and race car drivers and restaurant owners about how important it is for people to wear face coverings. We've got to remove the politics out of all of this. We've got to realize that strong people wear face coverings because it is a sign of compassion and that you actually care about people. So regardless of whether it's mandatory, we need to get people to wear it, but we're looking at the best ways to get more people to wear face coverings, and we'll have a little bit more about that next week. Thanks. Next question.
Our next question is from Jonah Kaplan with ABC 11.
This is Jonah Kaplan from ABC 11. I'll just ask you simply, what's holding you back from making this mandatory? I mean, you've been speaking pretty much for the last half hour, you and your team, about the importance of face coverings, how critical they are, the science is there. Why not just make this a rule today? Why wait till next week? And for Dr. Cohen, you and your staff have worked very hard on the math, numbers, percentages, graphs. But for every number we know, there's a name, a person, a family, a way of life. So our question, who is getting the virus? What are you learning from the contact tracers? You earlier alluded to how cases are being driven by 25 to 49-year-olds, but what percentage of positive cases are community transmission? Can you positively say that there are known cases of coronavirus from people attending mass protests, eating at restaurants, praying at church, flying on airplanes, or do most cases transmit at workplaces and congregate living settings? Thanks very much.
As to your first question, Jonah, there are probably more than a dozen ways you could write a law requiring face masks in different kinds of settings for different kinds of people. There's some people who have disabilities where they aren't able to wear one. You have to think about the age range of where you're going to make the requirement. If you're going to make a law, you have to be careful about what you're doing. You have to be specific, and you have to have it based on your best evidence. So you just can't snap your finger and say, hey, it's a rule, everybody do it. It's got to be something that's well thought through and something that will be effective with the least intrusion that we can have on people. So that's the kind of things that you think about. You also are going to get better results too when you can convince the public, heart and soul, that this is a good thing to do. So it's going to be important for business leaders and preachers and athletes and people who are on television as stars to come forward and say this is something that we can do to slow the spread of the virus. I think everybody wants our economy to improve. Everybody wants things to be open. Hey, the best way to do that is to wear a mask and social distance. And when you reduce the spread, there are more things that you can do out there. Dr. Cohen?
Well, thanks, Jonah, for the question. And I think you're asking exactly the right question of what is driving the viral spread. And there's no one answer. And I think a lot of the things you listed are I would say all of the above. What I can tell you is that as we see the increases in cases, we are seeing that being driven largely by younger folks. We're seeing that that our Latinx community, that it is being hard hit in particular. We know that there are certain settings that are more high risk. We put them up on our website, those that are required to report to us. So yes, we see long-term care setting, but also we know, and we've talked about a lot of times, our meat packing plants and other places where folks are close together for longer periods of time, indoors, where it's colder, right? That's where the virus spread. But we also are seeing reports of other types of outbreaks. We've seen them reported in the news, whether it's at a church, a construction site, at a child care setting. So this virus really is everywhere in our communities, and that's why it goes back to what do each of us have to do, no matter where we live, no matter where we work, no matter where we pray. How can we each help each other in slowing the spread of the virus? We know that some of these are viral outbreaks related to a particular space, But then we know many we can't link back to a particular action. So we know what you rightly said in your question, that we are having community spread and that the virus is out there. And that's why we want to be sure to be doing our 3 Ws, because we want to protect our grandparents or other loved ones in our nursing homes, because when we have more virus circulating into our community, that's how we put those folks who are in our long-term care settings at risk. So it's going to take all of us, and I think we've been talking a lot today about the importance particularly of face coverings, and the fact that the data that has come out, and I think rightly pointed out by another questioner, new data coming out every day about specific to COVID-19 and specific to face coverings. I think the more evidence we have helps us understand how we can tailor our actions even further. That's what we want to be doing, is being responsive to the data just came out this week and want to take action going forward. Thank you.
Thanks. Next question, please.
Follow-up, Jonah Kaplan, ABC 11.
Hello again, and thanks very much for the call. Governor, I just wanted to follow up with you when you also alluded to the fact that next week the Safer at Home order expires. We are seeing emails now from gyms and some other businesses already announcing their plans to open on June 26th. Are they being a little ambitious, or do they know something that maybe we all don't know yet? And Dr. Cohen, forgive my persistence, but can you give us a specific on what percentage of cases are community transmission, that contact tracers are finding that these COVID positive patients do not know where they got the virus? Thanks.
No one would know what is going to happen next week regarding the order ending June 26th, because no decisions have been made about that yet. Going to continue to look at the trends and indicators now and through the weekend and analyze that, consult experts, and an announcement will be made next week regarding the order that ends on June 26.
Hi, Jonah. It's hard to give a direct number to the question you're asking, and here's the reason, right? There are certain things that are required to report to us in terms of outbreak or clusters, and so we are very much tracking those. For others, we often have to do the detective work, and that's what's happening through tracing, but it doesn't mean you're always doing retrospective tracing, that you can always identify that something is back to one outbreak or one cluster. So while we do identify within a long-term care setting when there's an outbreak, we know folks aren't moving. We know the residents live there and they're not leaving, and so that's something confined that we can understand. But it's often hard when you're doing your tracing efforts often to lead back to understand, is that truly community spread or is it linked to an outbreak? We are doing that work, but it's detective work that takes a fair amount of time to sort of put those pieces together. So we continue to do that work, but we don't have an exact percentage, often because all of those pieces are very diffuse, and our work right now is to try to put some of those puzzle pieces together. And I think what we want to communicate is that we know the virus is out there. We know we're having community spread, right? We definitely are having community spread. The question is what percentage, but I think that regardless of that percentage, the message is it's out in our communities, and we need to do everything we can to slow that spread. We know there are particular areas that are higher risk that we keep talking about, and we want to be extra cautious in those settings, but everyone needs to be cautious no matter where they are. Thanks.
Thank you. Next question, please.
Our next question is from Michael Hyland with CBS 17.
Hi, this is Michael Hyland from CBS 17. I have a question related to hospitalizations. As we watch that number continue to go up, can you give us any clear indication of at what point that goes beyond just being a concern and you do actually have to take some kind of action? Is there any clear point at which restrictions could go back into place? Could this also be handled as a regional issue if it's not a problem at hospitals statewide? Thanks.
Thank you. We're continuing to watch the hospitalizations as they inch up. That is a concern. But one thing we know that is even more important than that number is the capacity that the hospitals have, and also the capacity of ICU beds and generators. And I know that the health experts are looking at that number and also beginning to look at it on a regional basis because we know that people often can't travel that far to go to a hospital. But I'll let Dr. Cohen expound on that.
Hi, Michael. Thanks for the question. Yes, so we both look at a statewide but also a regional level, as the governor said, because we often can move patients around within a region. We work very closely with particularly our large hospital systems where we see most of our ICU beds. We work with the Hospital Association. We are in constant communication with them about what they're seeing. And as we've been saying, yes, we are at our highest number of hospitalizations statewide, but we do have capacity in our hospitals. We do have capacity in our ICU, and we also are in, like I said, have conversations with folks. When we see things go up in a particular region, we're on the phone saying, hey, what's going on? What are you seeing? What are you doing? And the flip side of this is we want to make sure that folks are getting care for lots of different medical purposes. So we want folks to still go to the hospital, go to their doctors, whether it's to get their kids vaccinated in anticipation for hopefully moving forward with schools, or it's to make sure that they're getting the preventative care they need, the mammograms, colonoscopies. We want folks to be going to get their care. This is important to do. We'll continue to watch those numbers to say, is there a point that we get to that we might have to go back to a place of decreasing elective procedures? Could we do that regionally? I think we are looking at all the numbers to make sure that we will continue to have hospital capacity. And I know our hospital systems are also looking very heavily at those numbers and have daily leadership updates to make sure that they are understanding their capacity every day. Thanks.
Thank you. Next question, please.
Follow-up, Michael Hyland, CBS 17.
I wanted to follow up on the issue of the masks as well. Are you considering including any way to try to enforce this, or would this be similar to what's going on in Raleigh where they're trying to seek people to comply voluntarily? Do you think it needs to be something that has to actually be enforced in some capacity to work?
You need to have some kind of enforcement, and particularly we appreciate businesses and retail stores that have established policies that they want all of the customers to have masks on, and they do a pretty good job of enforcing that when they do make that decision. But enforcement is one of the issues that we would look at as we're examining the very best way to get more people to wear face coverings. You got anything to add to that? Okay. Next question, please.
Our final question today will be from Dawn Vaughn with the News and Observer.
Hi, Dawn Vaughn with NNO. Thanks for taking my question. Since I'm final, I've got a couple to throw out there. We were talking about enforcement and mandating. Why isn't there, or is there something holding back why there's not a statewide mandate for restaurant employers to publicly report when they have an outbreak or employees with it and tell other employees? Are there enough contact tracers to do that, to let people know when they've been somewhere? And that came up on the House floor this week, and Representative Meyer said that his daughter working at a bar had gotten the coronavirus, and her coworkers weren't told, and there was no mandate to tell that. And then related to the legislature, as you know, you have another reopening bill on your desk. There's probably, the Senate's going to pass one tonight. There's another one in committee. Are you going to veto all of these, or are these going to be addressed in the announcement next week? And can you tell us exactly what day you'll make that announcement? Thank you.
Don't know exactly what day it will be, but we will be announcing them next week. And I have concerns about these legislative mandates. It's pretty easy to vote for a bill that lifts a restriction when you don't have to deal with the consequences. And I think it's important for us to be thinking about the consequences of everything that we do, and also local and state officials need to have the flexibility to react, which these pieces of legislation impede. I'll let Dr. Cohen address the contact tracing and testing.
Sorry, Dawn, can you repeat the contact tracing question?
With the contact tracers, if people have been at restaurants, Representative Meyer said he hadn't, right. And then also, why aren't the restaurants and other businesses mandated to tell the public?
Sorry. So in terms of the requirements, so there are state laws around reporting requirements. Those are confined to some of our congregate living settings, schools, and childcare. So restaurants do not fall into that that bucket. Churches, construction sites, etc. But we know that that is where the virus is being transmitted, and so we are doing our work. And what the contact tracers do, right, is go through and do the detective work of saying, how can I call people who might have been in close contact? Doesn't mean just because you may have worked at that particular place, maybe you worked a different shift, maybe you weren't in the same location, right? So the contact tracers are trying to be thoughtful about understanding close contacts and being targeted in their efforts in terms of alerting folks who may have come into contact with folks. What we are saying in terms of, as you think about your testing guidance and your own personal risk, what I would say is, as you think about yourself and the kind of job that you have, or maybe you've been to a protest or another mass gathering, if you're going back to church and there are a lot of people, those might be reasons for you to self-identify, to say, you know, look, I might need to be tested, and I'd go to one of those 500 sites the governor kept mentioning to say, hey, I want to get tested. So I think there's two ways that people can become aware, right? Someone could call you, and you should pick up the phone from our contact tracers, but also be aware of your own risks and whether or not you should go get tested, even if you're not having symptoms. So again, we've been encouraging folks who have attended a mass gathering or a protest to go get tested. We also have been saying, do you work in a high-risk industry? That includes a restaurant, that includes a grocery store. So please, think about your own risk and do get tested at one of those 500 additional sites that we have there. Thank you.
Okay, is that it?
That's all we have time for.
All right. Thank you very much for tuning in today, and please stay healthy and safe out there. Thank you very much.